Hi, I'm Kathy Morrow, Director of the Family Medicine Clerkship, and I've been asked to chat with you about electives in family medicine. Um, there are a lot of interesting and fun electives that you might do in family medicine, particularly that involve some travel around the country. We can certainly find you some local electives, but we encourage people, in order to really experience family medicine, to travel to various sites around the country where there are some strong family medicine experiences. This session really covers electives, and probably my most important advice to you when you're thinking about family medicine as a specialty is to come talk to one of your clerkship directors in family medicine to get good advice about sub-Is in family medicine. I'm a strong advocate of making sure that you try hard to spend a month in a hospital or program that you know you're interested in. So, for example, if you're really interested in the Northwest, we are going to push you hard to get either a sub-I or a family medicine elective in one of the programs in Seattle or whichever area, region you know you're interested in. We feel that's very important in both respects, for you to get a good look at the program you're interested in and for the program to get a good look at you. There are a number of electives that are helpful in family medicine. The great thing about our field is it's so broad that virtually every elective you choose to do, whether it be a radiology elective, EKG reading, a derm elective, they're virtually all relevant to family medicine. An important thing to understand is family medicine sub-Is themselves are more important than an internal medicine sub-I or a pediatric sub-I. It is not that either of those is a negative, but rather that family medicine programs, especially the competitive ones, want to see your skills and abilities in broad spectrum medicine. So a good letter from some of the other primary care specialties, while helpful, is not quite as powerful as one from another family medicine department. So I'm going to encourage you to have a sub-I in a family medicine department, particularly in a program that you think you're interested in. One of our big electives are those in the IHS, the Indian Health Service System. We really encourage students to get into the Indian Health Service System because of broad exposure to a multiplicity of cross-cultural issues as well as clinical issues. We have lots of relationships with IHS sites, and we are really eager to help you find those. So whatever specialty you're going into, if you're interested in the Indian Health Service system, you should be chatting with us about helping you get set up in those rotations. If a student can't decide between two residencies is a common issue for people interested in family medicine. Lots of folks who go into family medicine struggle between family medicine and something else. Common pairs are peds in family medicine, OB in family medicine, psych in family medicine. And a lot of the advising I do is to people struggling between two specialties. So I encourage you to think hard about talking to us and the other specialty that you're interested in. Don't be shy if you're struggling between two specialties. It's really common. Nobody's distressed by that. We expect students to struggle with that. And I think your advisors in each of the specialties you're interested in are more helpful to you than any one particular thing I can say. However, I will add that doing sub-Is in both of the specialties you're considering is pretty important. I think sub-Is give you a stronger sense of what's the real work of this specialty going to be like, and what would my life as a resident be like. And so I'm going to encourage you, if, for example, you're interested in psych and family, to do sub-Is in both. Again, I will encourage you to come talk to your clerkship directors in those specialties to help sort out the decisions about how you spend your time. I think I mentioned EKG reading and radiology and derm. Those are really core electives in my mind, and I think virtually every medical student should do them. less common and less essential perhaps, but popular are time spent in ICU, internal medicine or pediatrics. I do think an emergency room month, as opposed to the required 2 weeks, is a really good idea for those interested in family medicine. Again, because of the broad spectrum exposure that it gives you. Highly competitive field. Well, all of medicine, depending on where you're looking, can be highly competitive. In family medicine, there is strong competition among the most popular dozen or so residencies in the country. My advice is to, again, to pick your sub-Is in those sites that we know to be particularly competitive. In family medicine in particular, the Northwest is a highly popular area for family medicine training, and a high percentage of students in Northwest programs go into family medicine. So that's a place that it's important, if you're coming from Dartmouth, you get yourself out to physically and are known. Third to fourth year transition thoughts. Well, if you made it through third year, you are really well placed to head into fourth year. And I hope, if you're watching this, you're feeling some confidence about your abilities now. I hope you're more than 2/3 of the way through your third year and you're recognizing how well prepared you're going to be for your fourth year electives. My experience across the country is that Dartmouth students are really appreciated, really valued, and well known for their high clinical acumen and skills. I never have trouble finding a slot for a Dartmouth fourth year student in a family medicine rotation. If we don't know of one immediately, we can find one in almost any program that you're interested in. And I think you'll discover that Dartmouth's excellent reputation as a medical school really helps you get the rotations you want pretty much anywhere. Having said that, I'm sure you've heard this from others, you do want to plan ahead. In some of the more competitive programs, the more local students will snap up sub-Is and rotations like that, and that'll be important. The final question that they've given me to say is, how much do you need to know graduating medical school? I love that question. Everything. As I think I said before, you know, you're really well trained, having come through your third year, your third clerkship year. You're really in good shape for your fourth year. Use your fourth year to reinforce a lot of what you've learned in the first 3 years at Dartmouth, to strengthen a few of those areas that you feel weak in, and to also have some fun and enjoy the work that you're going to be doing for a long time to come. Thanks.